personally, I would not want to have to make that decision on who is insured and who isn't, who would be seen, who could have medicine. I would hate to be the doctor or any health person to tell them, no, I can't see you, you're not insured, you can't buy medicine for your baby. I really think that we can sit and should be able to come up with some type of a solution.
Everybody should be entitled or have the right to receive medical care regardless of income, race, creed, color, or religion.
So many people right now who are working that do not have health care through their employer would be able to get health care if you add the employer into the mix for a less amount of money than they would pay in the open market.
And we like to expand this coverage for those who may be interested in taking advantage of it that are self-employed.
We decided that the buy-in program was the best one. And just like we already have, those kinds of incentives, benefits and things when we go to, we're looking for a job, we ask what the benefits are. If they have the buy-in program, that's gonna make us want to take that $10 an hour job that they're offering us. Not just the buy-in program for employers, to be able to do the buy-in program, but also extend it so that every Mississippian has an option to buy into the Medicaid program.
I believe that we should have the buy-in program and to support the Medicaid. I believe in raising the cigarette tax and alcohol tax, and I think if everyone is included in the buy-in, regardless of how much you can pay, it also gives you pride in yourself that you're contributing to your own welfare.
We decided on scenario number 2, the Medicaid buy-in. This would allow small businesses who aren't normally covered, who normally can't afford to cover their employees, an option to buy in. Small business owners who might not be able to normally afford to cover their employees now have at least the option of providing this service to their employees. It also gives those employees who work for small businesses an opportunity to have health care, whereas they might not be able to afford individual coverage without the employer paying some of the premium.
We would like to see an employer share the cost and have that available for individuals, but we also wanted to cover low-income adults, parents who are not disabled.
The parents and the child should get something.
Yeah, because you need to keep the parent well so they can together.
For a person like me who only makes $15,000 a year with 3 children at home, where do I fit in all of that? Currently now, with the Medicaid system now, I have to get insurance from work. My children qualify. I don't.
I think we ought to go for the dollar because it's more savings.
That's the way I think so too. Because you're going to have some young people who are not going to be able to afford another dollar onto what they're already paying for cigarettes.
Now, when we start looking at the cigarette increased tax, we're talking about $1. Even though I do agree that it should be higher than $1, but we're having a very extensively hard time even getting the man to think about $1. Now, it doesn't matter if they try to sit there and say everybody will quit. Some will. Some won't start. But those who have to smoke, let them pay the cost to be the boss.
I'm a strong supporter of raising the cigarette tax. I think it should go higher than $1. why stop there? If we really want to send a message especially to deter our young children from smoking, let's raise our cigarette tax higher.
Increasing the taxes on the cigarette would take care of a bevy of everything that afflicts society. Diabetes, cancer, high blood pressure.
We feel a $1 cigarette tax is appropriate because of the things it'll do.
We're going to do the cigarette tax, and we're going to do it for $1, because for $1 there's more money that's going to go into the fund, and we're going to put it in a special fund because special funds are designated for a specific program.
We feel if we increase the cigarette tax, a lot of the Medicaid deficit is from cigarette users and secondhand smoke. Secondhand smoke is just as bad as the person that's actually smoking. Yeah, we do have genetic diseases, but they're saying that we're in the deficit because of smokers. We're hoping that if the increased revenue go up, the cigarette tax goes up, smoking will go down, smoking-related diseases such as heart disease, cardiovascular disease, strokes, all that will go down, and we have some revenue left.
Cigarette tax? No, I don't know. No hospital tax. No hospital tax.
As you can always see, we don't want a hospital tax because that'll increase the cost that we're going to have to pay, each and every person that's sitting in this room.
Well, I mean, I'm definitely for the special fund, the earmark.
Yeah, that's what I'm for too.
Increase the cigarette tax to an additional $1 and make sure that all this money is placed in a special fund so that it can be used only for Medicaid.
I think the disabled needs to be expanded, because only if you're getting SSI or if you're one of the lucky 5,000 to get the little waiver do you get Medicaid unless you can work.
Prevention is cheap. But you treat emergency problems and serious illness, diabetes. If I can catch it in advance, you're going to be a cheap person to maintain on diabetes. But if you're already full blown and now you need a leg amputated, there's going to be a problem. You know, now it's going to cost the taxpayer even more money. So preventive medicine needs to be part of it, and that's going to save Medicaid itself a lot of money.
We shouldn't have as much Medicaid use if when the tax increase, because people are going to actually stop smoking.
There's no reason that nobody should have to go to the emergency room and sit there for 6 to 8 hours. My daughter went at 10:30. She's pregnant with twins. She was bleeding. She did not even get from the waiting room to a cubicle till 1 o'clock. She did not see a doctor till 5 o'clock. There was another girl that was pregnant that was there, and she did lose her baby.
You stop smoking, you become healthier. The people you live with become healthier. You don't spend so much money on Medicaid.
You've heard from your constituents tonight. You've heard simple, fundamental ways as to how to increase the cigarette tax and fund Medicaid.